Hi, it's the nursing professor here. I want to talk to you today about a brief review over mental health. So, we're going to start out talking about the difference between delirium versus dementia. The words sound alike, but they are totally different. So, when we talk about delirium, we're talking about a disease process that is acute, meaning that it happens sudden and is usually a result of something. So, typically, a person who has delirium has confusion, especially with short term memory, and it results from dehydration, urinary tract infection, fluid imbalance, some sort of disease process, poor nutrition, and of course, drugs and alcohol. Frequently, we see people, especially in the emergency room, that are going through alcohol withdrawal and they're suffering from what we call DTs or delirium tremors, where the body has these involuntary movements. You might see some slurred speech, trouble focusing, disorientation, and things like that. So, in comparison, we look at dementia, and dementia results from chronic brain changes, and actually, the physiology of the brain actually does change. It is progressive, not reversible at this point. And there are different types of dementia, but of course, the most common one is Alzheimer's. There's no cure for it, which is why we say it is progressive. And as a person continues to get worse because of these chronic brain changes, then frequently, if they live long enough, they will become total care because the brain will no longer provide the signals to the body to do those things that it should be doing. So that's the difference between delirium and dementia. So let's move on and let's talk about, let's start to talk about some neurotransmitters, because many times people who suffer from mental health illnesses have an imbalance in their neurotransmitters. So in particular, norepinephrine, which affects mood and attention. It is associated with fight or flight. It tends to be low in people who are suffering from depression, mania, anxiety, and schizophrenia. Serotonin affects your sleep, hunger, mood, pain, hormonal activity, aggressive sexual behavior. It is also very low in depression. So you can see from those two neurotransmitters, then if those levels are low, then a person could have these unwanted behaviors. Dopamine is always considered a feel-good drug, a feel-good neurotransmitter, I should say, and it affects fine muscle movement. It is involved with your emotions and decision-making. It's also found to be low in depression, so many times people do need something that is going to provide them some dopamine. And it's also low in Parkinson's. And so if you think about some of the Parkinsonian drugs, then they do have dopamine in them as well. Two other neurotransmitters are glutamate, plays a role in learning and memory. It's low in schizophrenia. GABA is... it reduces aggression. And many times you'll see this aggression with this increased anxiety that needs to be settled, especially in a person who has schizophrenia. All right, so those are neurotransmitters that our bodies naturally produce, and when the person experiences an imbalance in them, then they can have these unwanted behaviors, the mental health disorders that we typically know about. All right, so what we need to do about those behaviors that we don't want, then of course there's therapy, and along with that would be medication management. And so some of the most common medications that are prescribed would be lithium. You need to know about lithium. Very, very old drug, has a long half-life. And so typically it's only taken daily, but you really have to be careful about toxicity. Frequently, if a person's been on it for a long time, they would start to have problems with their thyroid or their kidney, and so those labs have to be monitored closely. Some of the symptoms that you would see if a person has lithium toxicity would be nausea and vomiting, and that's a clear sign that they need to get to the hospital because it's not easy to manage outpatient. And so lithium is used to treat mania and bipolar disease. And like I said, it's an old drug, so typically it's not a first-line drug that's used anymore. Haldol is quick acting. Many times when people come into the emergency room, they need to be quieted down because they're so agitated and out of control. Then we give them Haldol intramuscularly, and we're able to get them to calm down. It is used to treat severe behavior problems, schizophrenia. It can replace dopamine, and we just talked about the importance of having dopamine. Another drug could be Thorazine, or the other name for it is chlorpromazine. It's used as an antipsychotic, used to treat schizophrenia, bipolar, and acute psychosis. It can also actually be used before surgery to help someone who's restless quiet down. It can be used for hiccups, uncontrolled hiccups, and nausea and vomiting. Let's see, another drug would be Zyprexa, which is also an antipsychotic, and antipsychotic drugs are typically used for schizophrenia and bipolar disease. It does help to balance dopamine and serotonin. And one last drug that we'll talk about is tofranil, which is used to treat depression. One of the other unusual facts about that drug is it can be used in children and bedwetting, but primarily it is an antidepressant. Now, one thing you need to be aware of is that many times when these drugs are overused, rarely that it happens, but sometimes you see people get these involuntary movements, especially with their tongue, and it's called tardive dyskinesia. So you should be on the lookout with your assessment to make sure that your person isn't experiencing that. So there are some ethical principles that we should be familiar with, and this is across the board, whether or not we're talking mental health or med-surg. Beneficence means that you have the duty to promote good in others. Non-malfeasance means you do no harm, which is what we never want to be involved with, doing any harm. Justice is fairness. The right to be treated equally, and veracity is the duty to be truthful. And those four ethical principles really do go along with nursing, because actually we're considered the most ethical profession. And that's been for about the last 15, 20 years. So people do think highly of us, and we want to keep that. One last thing I want to talk about is be familiar with your theories, like Freud and Erikson. You can take the time to go through those, especially Erikson's cognitive behavior, and be aware of that. Know that there's when we categorize mental health disorders, especially for billing purposes, we use DSM numbers, and that is an official guideline by the American Psychological Association to help identify diseases. And so it standardizes diagnosis. So when these insurance companies get a claim, then say a DSM 45.6 means something to them versus writing the diagnosis out. And that really does help with privacy as well. Nursing diagnosis, of course, will go along with the symptoms, and so frequently it is safety that's involved with mental health illness. Sometimes it might be that you want the look at the dependence level of a person, or self-care deficit, especially with people who are experiencing depression. So that is the down and dirty of mental health. I wish you good luck on your exam. I think that pretty much is a good summary, and so I would suggest that you just kind of go back through and look at more details in those areas. And I'm going to post a few questions that might also help you. Just a reminder with lithium, then that you should know what the normal blood level is, because anything over 1.5, then typically a person is toxic. All right, bye for now.